What's up, guys? It's Dr. Jim. I am your CBD expert, your natural health care expert, and your worldwide virtual health coach. And I want to welcome you to tonight's live. Now, tonight's topic is awesome. You're going to love it. This is a hot topic. I went back and I started looking through videos to figure out what are the people most interested? What do you guys most want to hear about? And tonight's topic is CBD oil and blood pressure. One of the most requested things that I saw anywhere. So tonight's topic is CBD oil and blood pressure, right? That's important. You want to know about that one. So when you're getting on, thank you Stacy, Nicole, Sherry, thank you Susan, thank you for getting on tonight. When you're getting on, if you wouldn't mind putting in the comments, if you're watching it on Facebook or you're watching it on YouTube, put in the comments where you're coming in from and whether you're watching it live, because I gotta know. Are you getting the full energy of Dr. Jim live, or are you watching it on the replay? But either way, tonight's gonna be awesome. Thanks for the hearts and the taps and the love. I am excited. This is a big topic, all right? So tonight's topic is CBD oil and blood pressure. Now, just a disclaimer. Number one, I am not your doctor tonight. You are not my patient tonight. There's absolutely nothing about this video that constitutes a doctor-patient relationship, so please do not change anything about your current medical treatment because you heard me talk about something cool in this video. Second, all right, this is really important. Thank you, Nicole. This is really, really important. CBD oil is a natural supplement. It is not a drug. Therefore, it is not for the diagnosis, treatment, or cure of any specific disease or condition, including anything that we talk about in this video, all right? It's just really good for you, all right? So, tonight's topic, CBD oil and blood pressure. Now, before we get started, I just have some huge thank yous to give out. As you know, over the last probably 2 weeks, you guys have been voting for me to be the #1 chiropractor in Richmond. I appreciate it. I saw people voting multiple times every day, getting back to me, telling me that they're supporting me, and I want to tell you just how much that means to me, all right? Because I do these videos because I want to help you. I want to help educate you. I want to change the world, and guess what? You just taking the time out to vote for me means the world to me, and I just want to thank you so much for that. Really, really means a lot. So thank you. I'm gonna try not to cry. I'm also not gonna spend too much time on that. All right. So once again, the title for tonight is CBD oil and blood pressure. Now, why is blood pressure and why would anything having to do with your heart be so important? Why would this be such a big topic? Well, the reason is because heart disease is actually the #1 killer in the United States, all right? It is the #1 killer, all right? It's more than cancer, it's more than diabetes. It's the #1 killer, heart disease, all right? Now, and the truth is, if you look at the stats, it's reflected very similar throughout the rest of the world as well. So it's not just an American problem. It's a worldwide problem. So what is one of the main drivers of heart disease? You guessed it, high blood pressure, right? Really, high blood pressure. That's a problem, right? And roughly 1 in 3 people, all right, in the United States currently have high blood pressure. I mean, like a third of the people in the United States have high blood pressure right now, all right? So, do we think that learning about something natural that might be able to help you with your blood pressure would be important? Heck yeah, it would. So let's talk about what are some of the causes or what are the things that drive high blood pressure, because then that's going to help us when we talk about how CBD oil might help, all right? So number one, there is a problem called atherosclerosis, all right? It's a big term. Basically, it's like narrowing of your arteries. Plaque builds up on the inside of your arteries and it makes them more narrow. And the more narrow your arteries are, the harder it is to get the blood through, so the pressure gets higher. Now, what makes up these plaques, all right? Now, if you've been listening to just the mainstream media over, let's say, the last 30, 40 years, then you would 100% believe that what clogs up your arteries, and the entire problem with what's clogging up your arteries, that the entire problem is cholesterol, right? Yeah? I mean, am I wrong? That's what they say, right? It's cholesterol is the problem. Well, here's the thing. That's not really true, all right? The truth is that there are people that have super high cholesterol levels that have absolutely no plaquing and clogging of their arteries, and there are people with completely normal levels of cholesterol that have tons of plaquing in their arteries. So what could it be? What would be driving it? Well, here's the thing. What actually causes the plaques to start in the first place is, well, they are plaques made of cholesterol and calcium and stuff like that. So the problem is you make that mistake, you go and you look at the problem and goes, oh, there's cholesterol there, cholesterol must be the problem. But no, here's the thing. Cholesterol and the plaquing doesn't build up unless there's damage to the artery, right? Unless there's damage to the arterial wall. So how do you get damage to the arterial wall? Inflammation, right? And inflammation causes nicks in, hold on, sorry, inflammation causes nicks in the arterial wall linings, and when that happens, that's damage, and so then the cholesterol and the plaques go there like to patch up the hole, all right? So cholesterol is not the problem, inflammation is the problem causing damage, and cholesterol goes there to try to fix it, all right? So that's one cause, atherosclerosis, the narrowing of the arteries. Number two is there's a reason why the number one day that heart attacks happen is on Mondays, right? Stress. There's a ton of stress hormones that your body makes, and these often control your blood pressure and your heart rate. And so elevated levels of the stress hormone cortisol can actually raise your blood pressure, all right? They're made from your adrenal glands, your stress glands, and high levels of cortisol will increase your blood pressure. Because this is what happens. Cortisol is a protective measure. If you were in danger, basically your body wants to fight or run away. So you need to increase your blood pressure so that you can fight or run away. All right? Well, but guess what? The same thing happens in traffic. All right? Same thing happens when you're paying bills. So you can get stuck in this chronic state of elevated cortisol levels, and that will raise your blood pressure. Third, and this is the one we all know about, nobody wants to really talk about it, but it's excess weight and visceral fat. Sorry, I keep having this lighting problem. Jeez. So anyway, there is excess weight and visceral fat. And visceral fat is that internal fat around your heart and around your lungs. Because this is what happens. When you get fat inside your chest cavity, guess what? Your chest cavity is only so big. You got ribs there. So if fat starts to encroach in there, that puts pressure on your heart and on your lungs and on the blood vessels in there, and that'll raise your blood pressure. All right? So this is the thing. There's a lot of pharmaceuticals that are out there to treat high blood pressure. Of course there would be. If 1 in 3 people in the United States have it, and really around the world, certainly there's going to be a lot of medications for it. But this is the thing. A lot of these medications do have side effects. And, I'm trying to be as medication free as possible. All right. Now once again, back to the disclaimer. Absolutely do not change anything about what you're doing currently. Don't stop taking blood pressure medication or anything like that because you heard something cool in this video, all right? But this is the thing. I want to be more natural. So if there was a natural way that I could have a positive impact on blood pressure for now and for the future, I'd want to do it, right? So I bet you would too. So how does CBD oil, how can it help with blood pressure? Well, in 2017, the University of Nottingham did a study, and they found that a single dose had the ability to significantly lower blood pressure. Now here's the deal. They did use quite a bit, all right? It was a high dose, but it significantly lowered blood pressure right after, all right? So that's awesome, right? Now, they also found that the continued use continued to lower blood pressure, all right? So that's awesome. So there's an immediate reaction you can have from CBD oil of helping lower your blood pressure. But here's the other cool thing. What did we say with atherosclerosis, the narrowing of the arteries? See, CBD oil can actually vasodilate. It can increase the diameter of the blood vessels. So even if there is plaquing on the inside, if you make the blood vessel bigger, you open up and it reduces the blood pressure. All right, it's a cool mechanism. It's awesome how it does it. Probably something you would like, right? Now, long term, we talked about atherosclerosis and the plaquing. That what actually causes that, right? Inflammation is what causes the damage to the arterial arteries, so that's what made it go down. All right. The damage to the arteries is what made the cholesterol and all that stick, and that's what caused the plaques. So guess what? We know, and this is one of the number one reasons people take CBD oil, is that CBD oil helps reduce inflammation. Well, and if you can reduce inflammation, you can reduce the damage to the arteries that's happening over time, and you're going to have less plaquing and less atherosclerosis. And since that's one of the major causes of high blood pressure, CBD oil in a single dose and over time, by helping reduce inflammation, is going to help reduce your blood pressure. All right. Now, number 2, we talked that high stress hormones, that fight or flight, that got to fight or run away, that you get sitting in traffic and paying your bills. Well, guess what? A 1993 study showed that CBD oil could significantly reduce cortisol levels. That's awesome. You're telling me that if I get caught in a chronic stress problem, if I get caught in a chronic stress reaction and my cortisol levels are driven up and that's raising my blood pressure, that if I take CBD oil, it can help lower my cortisol levels. And if I lower my cortisol levels, it really might have a positive impact on my blood pressure. Yes, that's exactly what I'm telling you. That's awesome. All right? So that's way number 2. Now, number 3. All right? Excess weight and visceral fat. Now, you know I did a video on this a long time ago about how CBD oil can help with weight loss, how it helps with your metabolism. But a Korean study showed that CBD oil does something called fat browning. All right? It does something called fat browning, which is, there is the white adipose. That's that really inflammatory, yucky storage fat inside your body. All right? That CBD oil has the ability to help brown the fat, basically convert it from that white storage adipose fat to metabolically active brown fat, which means it gets your metabolism going. It helps things burn, all right? That CBD oil helps increase the number of mitochondria and their activity. Now, the mitochondria are the energy producers in the cells, so if you can make more of them and make them act more, then you can burn more energy. That's pretty awesome. And that CBD oil, actually, in this Korean study, they found that it helps inhibit the production of new fat cells. All right? So all of these things are awesome if we know that visceral fat and weight gain can actually help drive blood pressure. If CBD oil can have a positive impact in that area, sounds awesome, right? So to recap, CBD oil can have a positive impact on your blood pressure in a couple different ways. Number one, the research showed that a single dose helped reduce blood pressure, and that the other way is that over time, we know that inflammation drives the plaquing of the arteries, and if we reduce inflammation, which we know CBD oil does, then we can help reduce plaquing. It's a big deal. It's awesome. Number 2, we know that chronically high stress hormones like cortisol raise blood pressure. 1993 study proved that CBD oil helps reduce cortisol levels. You reduce cortisol levels, you can help reduce your blood pressure if that's what's driving it. And then number 3, excess weight and visceral fat. A Korean study proved that CBD oil can help turn white storage fat into metabolically active fat and can help the body burn fat, create more energy, and therefore it can be effective in helping lower your blood pressure by helping in your process of, hey Jana, of how you lose weight. All right? So, now, isn't that awesome? Isn't that awesome stuff? Doesn't that get you excited? Isn't that something you want? You know, if you have high blood pressure, I just want to urge you that you should definitely go get CBD oil. Now, if you want the CBD oil that I recommend, all right? Now, the CBD oil I recommend is amazing. It's top of the line. You will not find one that's better, okay? But it's amazing. It's top of the line. It's CO2 extracted. It's made in the United States. it's only got a couple of ingredients. It's third-party tested, so you know it's exactly what it says it's going to be. If you want that level of awesome CBD oil, then just put info in the comments, and we're going to send you a link in Messenger, and you can go check it out. Now, here's the other part. I was just, this weekend, if I look a little tired, it's because I was in Baltimore this weekend with an awesome group of people, and I got fired up about the business of CBD oil. Now, if you would like to be involved in the business of CBD oil, and you want to be on my team, all right? And you want to be on my team, then I also want you to put info in the comments, and we're going to send you a link for that, all right? Now, here's the deal. If someone else sent you this video, get back with them and they'll tell you what CBD oil to take. If you get back with them, you can get back with them and they'll tell you what, if you want to be on their team, you want to get in the business, they'll get back with you, okay? But if you're watching this video and if you're not working with anybody else, I would love to help you. All right, so put info in the comments and we'll send you links to all of that, to the CBD oil I recommend, as well as if you would like to be involved in the CBD oil business and partner with me and be on my team. Now, this is a big deal because heart disease is the #1 killer in the United States and really around the world. And I realize that CBD oil can have a very positive impact on it. All right, but guess what? If your lifestyle completely stinks, please don't put it all on CBD oil to save your life. All right, you have got to make changes. But guess what? What I know is a whole bunch of people don't even know where to start. All right, they don't know where to start. They don't know exactly what to do. And sometimes these healthcare conditions are really, really advanced. So what I've done is I'm collaborating with a group of medical doctors in Europe where we're using the most advanced testing in the world called metabolomic testing. All right, and what it does is it assesses your blood and your urine for all of the metabolites, the end products of every biochemical pathway that happens in your body. So every process that's happening in your body, there's a leftover product, and by measuring these, we can tell exactly what's going on in your body, exactly where any breakdown is happening. Therefore, we know exactly the perfect diet for you to eat and the exact supplements for you to take in order to fix it. All right? Now, if you want information on this testing and this program, which literally, if you have high blood pressure, high cholesterol, this will take care of it, all right? Without a shadow of a doubt. The doctors that I'm collaborating with have treated over 15,000 people with autoimmune and chronic health conditions with over an 85% success rate. I know it will work for you, and I will work for you. We will work together on making it happen. If you want information on that as well, go ahead and put info in the comments, and we will send you the link. You're going to get what CBD oil I recommend. You're going to get a link if you'd like to be on my team, and you're going to get a link to watch a video about the test and the program that I'm offering to basically help you. If you would like to get off the medical merry-go-round and finally be done with all this high blood pressure, heart disease stuff, if you want to live long enough to see your grandkids graduate from college, then you want this test. You want this program. Put info in the comments, and it's gonna change your life. All right. So CBD oil is awesome when we're looking at this. Yes. Thank you, Kylie. Yes, things are changing in your life because of what we're doing. So I appreciate it so much. All right, so here's the deal. Just like I tell my son every day before he goes to school, be your very best today. Hashtag never quit. And I believe that God wants the very, very best for you. And the day you believe that, change your life forever. Have an awesome, awesome night.